the moment when you've watched your loved one go through so much more pain. It was time. It was time to say hospice.
Yeah, studies have shown that hospice actually extends people's quality of life and extends, therefore, their own lives.
It's been said, too, is once somebody gets comfortable, they may have actually more quantity of life. They might live longer.
This is true.
Instead of all that taxing of, trying to fix. It's all about trying to get somebody comfortable. You're catching up on everything you've been out of control with. And those are your last days you remembered. And those are the feelings that are remembered because your feelings are your experiences.
Hi, my name's Kris Carter, and I'm the CEO, owner, operator of Aspire Home Health, and I'm here with my delightful co-host, Wendi Snell.
Hi.
Hey, Wendi, tell everybody a little bit about yourself.
Yeah, I'm Wendi Snell. I'm a nurse. I've been a nurse for 28 years, and I've been the director of nursing at Aspire Home Health and Hospice. I was it for 14 years, and now the chief operations officer, working with my amazing partner over here, Kris Carter, who's the CEO, like
Thank
she
you.
mentioned. Yeah.
Well, Wendi, do you have children? Tell us a little bit about yourself.
So I have 3 kids. 2 of them are married. One of them's almost married. I have almost 3 grandkids.
That's
One's
so
going to be
exciting.
born here any minute.
Probably on Monday.
Right. Pretty soon.
That's exciting.
So, yeah.
Yeah.
They are, my last one is in college. Everybody's living the dream, right?
They are, and you're planning a wedding.
And I'm planning a wedding. Yes.
Ooh.
Yes. I know
Wow,
that's
that's
coming up
crazy.
in a month and a half, but it is. My daughter's getting married, so I've done 2 weddings for the grooms, but this time we're doing the bride. So yeah, it's been
That's a whole
crazy
different
busy
story,
right?
isn't it?
Crazy busy, but so good. And my husband, we've been married for 32 years, and he has supported me all along the way as a nurse, and so I love it here at Aspire.
Well, we love having you here at Aspire. The thing about Wendi is her warmth radiates this whole entire organization. It's been said around here that if you get a Wendy's hug, it's a whole entire conversation of love just in one big squeeze. She's known for being such an amazing and compassionate nurse, and I'm honored to be able to work with her. Wendi and I, we spent a lot of time together, and, I was thinking about a couple of years ago, Wendi. It's been longer, though. It's been, 7 years since you and I were talking, and you looked at me at lunch and you said, you know what? My dad looks like a hospice patient.
Yeah.
I remember that day. That was 7
It's
years.
actually almost been 10 years.
Oh, my
Can you
gosh.
believe it?
We
Time
worked
is
together
going-
that long.
Yeah.
And
Yeah.
I remember that day very clearly. Describe to me what you were seeing.
So my dad, just his health was declining.
Right.
And it was hard to pinpoint what was happening. A long time ago, he had a traumatic brain injury. So as you see the decline, you're wondering, okay, is this just the process
Right.
of starting to get a little dementia? He's starting to fall a lot. He, had multiple episodes of just falling. One time he was up on a cement stair and just fell all the way back.
Was that
And-
right when you came and said, my dad
Yeah.
looks like a hospice
And
patient?
he looked like he was losing a lot of weight. He was going to his doctor appointments. Doctors didn't really give him answers of what was going on, but I could just see he was declining
Right.
and no answers, and trying to put the pieces together and trying to make sure he got care, or what could we do about this, except we just continued to watch him fall and fall and fall, and nobody was giving us answers. And so finally, I went with him to a doctor appointment, and the doctor was just saying, well, let's just watch it. You've lost 20 pounds in the last couple of months. Well, maybe, and I just said, can we get some blood tests? It's frustrating when you're watching a loved one decline so much and nobody has answers. And so you're going to every doctor you possibly can or trying to find those answers.
And what was hard too in your situation is your mother was still in the picture. She still is. She's a vibrant, beautiful woman. She's amazing.
Absolutely. Well, and she was trying to work with it too, but because I've had experience, in the field being a nurse, you ask the family members that are nurses. I have another sister who's a nurse too. And so everybody trying to put together the pieces and try to, make sure he gets the care he needs. But so we finally, at one point, he wasn't able to go to one of his grandkids' functions that they had. And that was not like my dad.
Right.
And that was the day we were all on the phone and we're like, this is not right. He can't get out of bed. What can we do? He did end up going to the hospital, and that's when they found cancer.
I remember that day. That was so devastating. The doctor said something to you that really changed and really made an impact on your family. I remember he said, didn't the doctor tell you then?
Yeah, he said, that's a bummer.
Oh, yeah, that's right. That was
because we had actually been at his office probably less than a month before that, looking at x-rays, looking at everything, because we were trying to find out, why does he have so much back pain? Did he break something? Did he get a fracture? And nobody had these answers. And so, yeah, when he was actually diagnosed when we were in the hospital, he came and said, bummer. And that's really stuck with me because as family members, when you are just trying to get the right care for your loved one and nobody's got the answers, bummer shows the pain it is for families to go through to try and get that care that they need. So finally, we got the answers. And, my family is trying to make these decisions. Okay, what's next? We now know he has terminal cancer is what they, found out.
And let me put this out there. You have two nurses in your family.
Mm-hmm.
One's very acquainted.
Yep.
Currently the director of nursing of a hospice agency. So we're dealing with very smart, intelligent, reasonable, and rational people very struggling with this very difficult thing where you're still very a part of what goes on.
Yes, trying to get to the right doctor who can just give you that diagnosis or figure out what's the next step.
Was that just so incredibly hard to be in that? Yeah. I mean, was it just so frustrating to be in that situation, knowing something's going on? The answer's bummer.
Right, absolutely, because knowing all the ways that people qualify for hospice, like I told you, I saw almost every step, but yet couldn't get that answer. So finally, when we had that answer, we had to make decisions.
Right.
And, it's, okay, do we do rehabilitation? Do you do chemo? Do you do radiation? What, all these different choices. What do you do? And, also the word hospice came up because it was terminal.
Yeah.
And so the family had to make that decision on what are we going to do? And, reluctance to the hospice, right? Even though I've been a hospice nurse and here I am helping run an agency.
You now own it.
Now owning home health and hospice. I knew the benefits of hospice, but you've got to have a family that comes together and, is it rehabilitation first? Is it radiation? You've got professionals trying to guide you along that route. And so the family did go down some of those routes and did some rehab and did some radiation. But at the moment when you've watched your loved one go through so much more pain, it was time. It was time to say, hospice. Let's take him home. Let's get him comfortable.
Yeah.
Give him some quality of life and have his family surrounding him instead of, at a facility where he's being put through, more and more pain all the time. Let's just get you comfortable and come home. And that's when, the decision was made to go on hospice. But hospice doesn't mean you're giving up everything.
So I see some tears in your eyes.
Yeah.
You have some feelings.
Absolutely.
Share those feelings with us.
Even though I'm a nurse and I've taken care of many home health and hospice patients,
you're a beautiful
it's different
nurse.
When you're sitting in that family and patient chair.
Oh.
And it's your loved one that now your family's coming together to try and make sure you're doing the right care for your dad. This is my dad, and I want to make sure that we don't miss anything. And sometimes that stigma of hospice is you're giving up, right?
Right.
But, coming together as a family and deciding, no, we're giving him more because we're giving him that quality and comfort so then he can enjoy his last days with his family.
Yeah, studies have shown that hospice actually extends people's quality of life and extends, therefore, their life.
Absolutely.
Yeah.
Absolutely. And gives the opportunity for the family to be able to resolve things in their life or come together and be there for their loved one. So we all got to be there for my dad. We took turns, helping my mom care for him in the home. Hospice brought all the equipment that it took, a bed, shower chair, the wheelchair, everything that hospice pays for, the incontinence stuff, everything that we were facing at that time, the medication to keep him comfortable.
I remember coming to visit. I do remember going in and coming into the family home and to see how it was set up where everybody could be still a part of gathered together around him.
Absolutely. That was the best decision. And then we had, even though, like I said, I've done home health and hospice, I needed that support from a team. And so then we had hospice come in and support my family, and I could be the daughter.
Yeah.
And the whole team came in, social work and the nurse and the aides and the chaplain, and everybody came in to support my family and brought, the medication that was needed. And my family they have a deep relationship with the hospice nurse and the aide and everybody who came because they made such an impact on my family and were there every step of the way. And for me as well. And my family was able to rally when, they guided us to tell us, okay, this is what you're looking for next. And here's the next step. Here's what's probably going to happen when this happens. Let us, keep us informed so we can be there for you. And even as my family had gathered and my dad, took his last breaths, his hospice nurse was on that front porch minutes after she had been supporting us through the whole thing. She knew it was going to be close, so she stayed close by. And the moment he took his last breath and we were letting her know, she actually was at the front door. She said, I'm actually here. You let me know when you need me. And that's what a hospice can be for anybody. It's scary. There's no do-overs. You want to do the right thing for your family. My dad, I never know that I was in training to take care of the most important person in my life. And he ended up being a hospice patient for us. And it just was beautiful and helped my family come together and be able to know we did the best that we could for him and that he was taken care of.
Oh, so beautiful. He was such a loved man. You guys were such a great family. I remember how you guys all rallied around him. Wendi, thank you. Thank you for bearing your heart and sharing your soul. Really appreciate that. You're just a beautiful person inside and out, and it's such a joy to have you leading our team because it's your warmth and your love and your knowledge of what it's like to be in that patient and family chair and how hard it is. It makes an inspired difference.
Thank you. I just think that that's my passion and opportunity to share that with people. So thank you.
Wendi, as a professional and as someone who's had your parent on hospice, when would you suggest to people that they start looking into hospice?
Many times I see that people wait too long and it's a crisis mode and you're just trying to problem solve right at the moment and you don't get the time to enjoy and really connect with your family. So when you start seeing that decline and you are working with the professionals, the physicians and different groups out there, anytime it is suggested to start hospice, I think that's the time to really talk with your family and decide, okay, what are our goals? What are the end goals? Do we want to keep taking them to the hospital, keep pushing all the rigorous, painful treatments and getting them in and out of that house, how difficult and taxing that is? And people decline faster the more you're putting them through.
Okay, so what if, kind of like with your family, your physician was really reluctant to even give a cancer diagnosis, let alone suggest hospice? That was never really on the table until
Right.
you as a family came together and said, you've kind of had enough. What are some of the physical signs that you would be watching for that would suggest to you as a lay person,
Right.
this person may be needing hospice?
Right. You're looking for, have they had to go to the emergency room multiple times in a year?
Right?
Multiple infections.
Would something like a urinary tract infection count?
The upper urinary tract infections count, multiple history of those, respiratory,
Right.
lower respiratory infections, things that continue to decline, especially when people end up in the hospital multiple times.
Mm-hmm.
And they need to look at, okay, what are my goals here? Do I want to keep treating over and over and over to the very last moment, or do I want to have some quality time with my family and be comfortable and be able to live in their home or wherever they're living at the time and just enjoy that. And so the sooner the better, because when you have a team from hospice that come and support you as a caregiver, you're supported all the way through everything with social and, spiritual, the care that your loved one needs. We can have an aide come in and help bathe them and dress them and take some of that stress and pain away from that caregiver. Sometimes it's said that the caregivers decline faster than the patients. And if you have a team that can come and be your heroes and rescue you from that means so much more. So if somebody tells you right away, don't wait to the last week or days. 6 months or less is usually the time frame. If they tell you you have 6 months or less, take it. Take the opportunity to get those services going for your loved one. That gives you the time to get all your affairs in order. That gets you the time to really talk and make sure you're ready and you have everything you need. And have the time to, your loved one gets the medications they need, the services. So don't wait.
There's a hospice myth out there that hospice is just for the last few days of life.
Right.
Can you speak to that?
Yeah. Usually if you're waiting to, like I said, the last few days of life, you are all in crisis mode. It's all about trying to get somebody comfortable. You're catching up on everything you've been out of control with. And those are your last days you remember. And those are the feelings that are remembered because your feelings are your experiences. And so
you're just
lasting memories.
They're just remembering the crisis of
Exactly.
it all instead of being able to create that lasting, beautiful memory.
And, it's hard for people to believe that in the world, that it could be a beautiful memory.
Right.
But if you allow the professionals and people to come in and help you with something you've never done before, because we don't go get training for this, anybody in the world, right? Certain professionals do. And so allow them to come help you, walk you, hold your hand through this whole process. It's kind of like birth. You allow the professionals, you go and do your appointments and go,
and then it comes anyway, whether you're prepared or not.
So take the opportunity to let professionals walk you through that and touch your life and make it beautiful instead of the crisis at the very last minute. And, it's been said too, is once somebody gets comfortable, they may have actually more quantity of life. They might live longer.
This is true.
Instead of all that taxing of, trying to fix.
Now, Wendi, there's also this myth out there that hospice is a limited benefit.
Right. No, it is unlimited. You have to qualify.
Absolutely.
What the doctor is looking for is if you, given your trajectory and someone's normal disease process, would it be unreasonable that they would be gone in 6 months? They have less than 6 months to live. And that's what we continue to watch. We're watching for, the decline and make sure they still qualify for the hospice.
That's really important.
Yeah.
Now, Wendi, let's say you're talking with your best girlfriend.
Yeah.
Or family member.
Yeah.
And they are telling you about the struggles that they are going through with their loved one. What would you tell them to do?
You know, I've been in this situation many times. I've had many dear friends reach out to me because they've gone through the same struggle as I watched my dad decline. They were watching their dad decline. I actually, less than 6 weeks after I watched, through my dad, or not too far behind, my friend said, my dad's been declining too. And I continued to help. And at what moment, they decided, let's call Wendi. And they had the same exact scenario of hospice came in, started taking care of their dad, and were able to then have a beautiful ending for their family as well, instead of the crisis mode and continuing to go to the hospital and keep doing, trying to treat when there really wasn't a treatment. It really was going to happen either way, but could we make them comfortable? Could we help mend the family? Could we help people come together?
So you would advise them to call Aspire and inquire and ask for Wendi, because that's what a lot of people do is say, hey, Wendi. And it was really fun. I went to a party at Wendi's house on Friday and ran into this woman that called and said, Wendi, what do I do?
Yeah.
And she still told me, it's been almost 10 years about how much hospice, and Aspire Hospice in particular, really changed her and her family's life and made it such a beautiful experience. So I would invite anybody who's listening to give Wendi a call at Aspire Home Health and Hospice at 801-292-0296, or go to our website at aspireutah.com.